Hello viewers and a very warm welcome. You're watching India Fights Back with your host Kriti Mishra. The World Health Organization has said that the coronavirus B.1.617 is a global variant of concern as scientists reported new clues that suggest the mutations may be making the pathogen more transmissible. In recent days, new assessments disclosed by scientists showed that B.1.617 and its particular lineage have rapidly expanded their footprint in some regions, and in lab tests show that they can lead to a high viral load. And let's find out more about this variant from our eminent guests. Joining us on the program today, Dr. Ekta Gupta, Professor, Department of Virology, ILBS, and Dr. Rakesh Mishra, former Director, Center for Cellular and Molecular Biology. Welcome to Ratsabha Television, both of you.
Thank you.
Thank you.
And Dr. Mishra, coming to you first, what makes this double mutant COVID variant, which is B.1.617, so concerning?
So it is a nature of the virus to keep mutating and coming out with new variants, and it's in process of natural selection where whatever variant will be more successful in spreading will be the dominant one, and we have been seeing for past 1 year, few months that one after other variants keep coming. So in that sense, it's not something unexpected or unusual. And we have seen A3I here in the south, then that disappeared, then A2A came, and like that, many variants keep coming and going. And just to make it clear, at any given time, there are a very large number of variants around, but most of them don't succeed and they disappear. But some become very prominent, like UK variant became very prominent, came to India, at the northern part of India and Punjab, Delhi, and other parts. And then this variant, 61617 B.1.617, originated most likely somewhere in Maharashtra. And this also, like any successful variant, has a better ability to infect. That's why it is replacing the earlier existing variants. And it's dominating now in several states, including West Bengal, Maharashtra, Karnataka, and maybe other states, even in South, is making the larger footprint. So this is expected that a new variant will come and that will be more infectious. That's why it will survive and replace the other one. Whether it will cause more problems to us in terms of mortality, in terms of symptoms, in terms of breakthrough infections for vaccinated people, whether it will respect vaccination or not, those are the larger issues that we need to worry about.
All right, Dr. Gupta, coming to you. What is this B.1.617 variant? If you could explain that to our viewers in simple terms, ma'am.
Okay. As Dr. Mishra has told you, that this is SARS-CoV-2 is an RNA virus, and this RNA virus is known to mutate. Now, when it mutates, it brings about certain changes in its genome sequence, and by sequencing, we classify it into various variants. There are certain variants of interest, and then there are certain variants of concern. We call it, it was started in Wuhan in 2019. So we used to name it as B19. Then there are certain types of classification where A2 strains came, A3, A4, and now the one lineage we are reading is B.1. The UK one was B.1117. The South African one was B.1351. And now this variant, which is Indian variant, is B.1617. Now, this was identified in November 2020, and especially from Maharashtra, and we called it as a double mutant because it showed two significant mutations at the spike protein of the virus. This spike protein of the virus is an important part because this is the part which binds to the receptor and makes the virus enter into the person's body. All our vaccine and vaccination drive is to neutralize this spike protein only. So whenever you will have mutation in these spike protein, the chances that attachment of the virus can be faster, or its capacity to evade the immune response, that is evade the vaccine escape, becomes higher. So that is why this 617 became a major concern for us, because we saw that earlier way back in November 2020, when they showed the study out of few whole genome sequences they did, they found that UK variant was dominant in India, and this Indian variant was there in certain parts of Maharashtra and certain parts of the North India. And in Delhi especially showed a lot of UK variant. But then as the infection proceeded and we had a lot of people getting infected in the months of April, March, we saw that the study which is recently done, that in Delhi now the entire virus which is circulating is this B.1.617. So this has become now the dominant viral variant circulating in our part of the country, then especially Delhi and the other northern part. So this, because of its increased transmissibility, it's so infectious that earlier one, when it was infecting 1:4 people, this one will infect 1:8 to 10 people, and with a lesser contact time. So that is why it is infecting more and more. So it is the major now variant which is circulating in Delhi. It has become. It is a matter of concern because the studies have shown it has shown increased virulence, increased pathogenicity. So the chances that if you have lesser load of the virus and you immediately become sick are more in this. It can infect more and more people. So if a person is carrying this variant, the chances that he can infect, that person can infect more is more. And it is also seen that this variant can cause infection in those who are vaccinated, both with Covishield as well as Covaxin. So that is why this variant, which is circulating in India, has become a variant of concern right now.
All right, Dr. Gupta, those were the important points about this new variant of the virus. But Dr. Mishra, a lot of us, the experts, have also been saying that there is this new surge in India because of this particular variant. Could B.1.617 be the driving force behind this ongoing surge that we're seeing in COVID-19 cases? Do we have such studies to prove that?
See, the virus is only a substance. Of course, if virus was not there, there will be no pandemic. But the virus does not jump on its own. It doesn't go through water. It doesn't go through mosquito. It goes only when two people are together without protection. So we have been behaving what we call as not in COVID appropriate behavior, and we have opened all the activities compared to what we had after the first lockdown. Gradually, we thought that virus is gone. And this virus, which is more infectious, I just heard from Dr. Gupta, it is certainly more infectious because given equal chances, this one will infect more. And that is why you see now other variants being replaced by this one. And also we have noticed that it has a low CT value, which means the virus load in the individuals are more. And that makes it more infectious, that many people in family get infected, not only one, two. And that's why we have seen the doubling time was very, very fast. That's why this wave is so sharp. It was just amazing. None of us would have imagined that it will go that fast. But every time there is a spread from one person to other, two people are actually violating the COVID appropriate behavior, then only it is happening. That we must take that as responsibility. So the activities like election rallies, like religious functions, marriages, school opening, mall, cinema hall, restaurant, all these activities, public transport, all these encouraged this virus, which was already waiting. This virus is not new. It originated actually in October sometime, and it was lying low because of COVID appropriate behavior, some restriction, and it takes some time for a new variant to emerge, even if it is more infectious. But it got the support of people who were not doing COVID appropriate behavior, and then it's picked up from there. I don't think this virus particularly is more symptomatic or has a higher mortality, but now we are having a problem in big danger because stretched out healthcare system. These people have been doing heroics for 1.5 years now, and now this huge burden comes on them. So we are in very difficult situation. The virus may not be, mortality may not be very high, and if given good condition, good care, not crowding in the hospital, we can probably keep the mortality low, less than 1% or something. But if we cannot take care, so the people who could otherwise be saved, now they are under the risk. That is what is a huge, huge problem. And that's why the first and foremost thing is to break the spread of this virus, break the chain of this. That hospitals will not do, that people will do. So whether we do through lockdown, whether we do with the police, with the military, whatever, but we have to stop the virus from spreading, because we cannot convert whole city into hospital. That's not possible. There is a limit to those things, and we are stretching the limit quite a bit by now.
Absolutely. And every country in the world has a limit to its healthcare infrastructure. And it is incumbent upon all of us, the onus lies on all of us to follow the COVID appropriate behavior. We completely agree with you on that, Dr. Mishra. But Dr. Gupta, we'd also like to understand, are there studies to prove, or do we have any research as to how did this double mutation variant emerge?
There is enough of the literature that this virus, like from the very beginning, when the first sequence of this virus was published in the January 2020, after that we started seeing the literature. There are about more than 5 lakhs whole genome sequences which are uploaded, and we saw that how the mutations have been coming regularly, and that is why we call certain as variants of interest, certain of variants of concern, and the major variants which I have earlier said from UK, Brazil, South Africa came. Now this B.1.617, which is our Indian variant, it was reported early in the month of, I think, end of 2020, in the beginning of 2021, that this is there. And the UK and Brazilian variants were also, South African variants were also, through the sequencing consortium we have in India, they reported that these, although in the low prevalence, they are there. So there are a lot of studies which have been there. Recently, I think the Indian consortium, it is a preprint version only, which is not been reviewed scientifically, but which with the UK consortium, they have a preprint version has been made available, where they have studied the 617 Indian variant, and that is why the WHO has now released that it is of a global concern, because they saw these 3 mutations, and they saw that these mutations increases the transmissibility, infectiousness, as well as capacity that it can invade neutralization by the vaccines. Although the studies earlier which were done on the UK variant have shown that both our Covishield and Covaxin were working in good capacity to neutralize those variants. So there is a study which is in the preprint form, which is by, I think, the consortium of sequencing of Indian consortium, was along with UK consortium, which has been published in a preprint version, which shows that it has increased transmissibility. Yes.
Absolutely. So this is how we are going to say that this variant is more virulent and of course transmissible. But since you're talking about vaccination, madam, I'd like to take it to Dr. Mishra. Dr. Mishra, can this new variant completely evade vaccines? Can we say that? How do you rate the vaccine efficacy on this particular variation?
See, the vaccines are, this is just extraordinary opportunity that we have with us. So these vaccines are known that they have 70-80% efficacy, means 20-30% people might get infected even if they are fully vaccinated. But it has been shown that even if they are vaccinated, they will not need hospitalization, or even if they needed hospitalization, their stay in a hospital will be less and their symptoms will be less severe. And as far as I understand, there's hardly any death if the person is vaccinated. That's large scale data is now available. So the vaccine in that sense are 100% efficacy, but breakthrough infection will happen, and that is happening. Just now you heard from Dr. Gupta that breakthrough infection is happening. So which is those 20-30% people who will be still infected even if they are vaccinated. We have done this study, and ICMR labs have done a study, and also the third phase trial data suggests that both the vaccines are, trial data is for the Covaxin, because this variant came only late, that these vaccines are protecting against this. In the lab conditions, when we culture the virus in the lab and challenge the virus with the serum from Covaxin vaccinated person or Covishield vaccinated person or person recovered from natural infection, in all 3 conditions, we saw the protection. So which means we are not having any big problem for the vaccine. Maybe virus will try to come up with the newer versions. It will try to break through vaccine because that is the essential for the survival of the virus. But at the moment, we are okay with the vaccine. Important thing is to do vaccination very, very fast speed before virus. It is a race. If we give enough time for virus to mutate, it will keep mutating. That is its strength of the virus, only mutation. It will keep mutating randomly, and if lakhs and lakhs of people are allowing the virus to do experiment in their body, come up with newer version, maybe a version will come that will negate the vaccine as well. So that, to reduce that risk, we should vaccinate very, very fast, largest number that is possible. A and B, break the spread of the virus, so we don't allow the virus to play with us and keep its various mutations. And yeah, if we do these two things, and of course to do that effectively, you should test large number of people so that whoever is, because most people are asymptomatic. That is the strength of this virus, that is silently spread from one person to other. So we to do a lot of testing so that we can isolate people who are positive, so that virus is choked at that, and then the COVID appropriate behavior, whether we are vaccinated or not. That will be another attack we can make on this virus and the vaccine. If we do these three things, we can come out of this pandemic without much damage. If we don't do any one of these, we will be having lots of damage, because the virus is very, very infectious, as we are seeing, and we cannot afford complete lockdown for a very long period of time. So people have to now tighten their belt and be ready for 3-4 months of very disciplined interaction, very disciplined COVID appropriate behavior. That's going to be extremely important. I mean, I keep saying that the future, what will be for 1 year of this pandemic, even for 10 years, is going to decide how well we are using the mask today. If we don't do the mask, the damage will be such that we will be having its scars for many, many years to come. So next 6 months, mask is our best bet. Take the vaccine and keep isolating those who are testing positive, and more and more people should test. If we do these things, we can still come out with the lesser damage. Otherwise, we will not only have a lot of damage here, we will see more waves coming, because virus will keep its all the tricks all the time, and if we allow it to happen, it will cause damage to us.
All of us have to be united in this fight against this pandemic and against this virus. But Dr. Gupta, a lot of people are also asking whether this particular variant poses a threat to the innate immunity besides infection as well.
No, I don't think so. Matlab, the till now, whatever studies have been done, they are only showing that this particular variant, if you're talking, is increasing in the transmissibility and infectiousness. But however, any of the variant of the virus has not affected the innate immune responses of the human beings or the host, which are being studied. Whatever it is affecting are the acquired immunity, the antibodies it produces against the spike protein, and the neutralization capacity. So this one, I don't think so, but yes, larger studies can be done to see, as Dr. Mishra has said, that these are very small, it has spread so fast, and very few studies with limited samples, we have identified that this could be the reason of the fast spread. But apart from the fast spread of this variant, there were many other factors associated with caused the surge to occur in India, the second wave of infection and rapid increase of infection. It is not only because of the spread of the variant. Earlier when we saw, so it is not affecting any immunity per se in those who are vaccinated, those who are not vaccinated. So I will not say that this has a higher chances of affecting. Only thing is that there was a variant. It had some transmissibility, and because of the lack of COVID appropriate behavior, large gatherings, we allowed this variant to become the dominant variant. That is what we are saying, that there can be variation occur, but it is up to us whether we allow it to become the dominant or we do not allow. That is why we want that more and more should be vaccinated, at least, so that the severe disease is protected, and social distancing, mask wearing should be there, so that any variant of concern which develops later also should not become the predominant or dominant variant like this one and causing more and more infectiousness, right?
All right, Dr. Gupta, since you're talking about the studies and the research, what about the cases of reinfection?
Yes, we have seen reinfection. I'm not saying that the reinfection is not now being reported in Delhi itself, but the percentage of reinfection is very, very, very low. It's not, if you see, so there are reinfections, and reinfections are particularly seen, especially like from our lab data after 6 or 8 months of the first infection. So the immediate reinfection is not being seen. I think whatever virus, so it could be a possibility that, as we have said, that those who got infected with the initial Wuhan strain or the initial strain which was circulating are now getting infected. So the reinfection has been documented, it has been seen. To label it as a reinfection or whether it was a prolonged viral transmission, those data is also not available with us. But yes, we are seeing clinical cases of people who got infected in the first wave, and then after 4-5 months, now they're again coming with a reinfection. So but the percentage is not that high. Is not. But that is why, because of the reinfection, we are stressing that even if you have acquired infection, even if you are vaccinated, the mask wearing and social distancing is a way long. It will stay with us for next 2-3 years. It should become our habit and practices. Because why? Reinfection is seen. Those who are vaccinated, the infection is seen. Yes, the severity of infection is not seen in those who are vaccinated or fully vaccinated, but at least the respiratory illness, the fever, the malaise, weakness, all those are reported in them. So why to have more infections and then allow the virus to mutate further? So it's always better that you should adhere to the COVID appropriate behavior, and mask wearing and social distancing will have more effect along with vaccination, so that we bring down the rate of spread of this virus.
Absolutely. So time for quick closing comments from both my guests. Dr. Mishra, first to you.
Yeah. So we have just heard all the basics that viruses will mutate, that is their nature and that is their strength. This virus has additional strength that it is not seen most of the time. 80% of the people don't know whether they are carrying the virus or not. So these are the things we should be prepared. We should know our enemy, then only we can defeat it. The only way to see the enemy is by test. So if we test, we know that the person is infected, and it's very simple that 80%, 90% of people will not need any medical attention. They just need to be under self quarantine at home, so they can block the transmission. So these are the very factual things. And you also just heard that vaccine is there. We should get vaccinated, but vaccinated people can also get infected, and they can also unknowingly keep spreading the virus. The chance that in vaccinated person virus can emerge with more nasty symptoms is larger, because vaccinated person is providing more resistance to the virus, and virus will respond. It is its natural process. So even after vaccination, we should not make any relaxation in our mask discipline. We must wear mask all the time when we are outside. So as I said, we know how the virus is spread, so therefore we can stop it from spreading. We have to take the matter in our hand. Government will help by testing, by identifying who are infected, so they can quarantine. Government will put more restrictions so that there is no crowding, but crowd is created by people. We have to see that even if it is not told, we should not go out without any purpose. Whenever we go out, we must wear mask with a strict possible extent, and wear the mask properly. Mask is not to protect our beard. Mask is to protect our mouth and nose, and that culture should come. Anybody going out without mask is not a civilized person, because it is not that person who is risking his health. The person is going to spread the infection in his friends or her friends and family members and near and dear ones. So it is really very unsocial not to wear mask. So that's the culture we have to inculcate, that wearing a mask is like wearing shirt when you want to come out. And
Yes.
we know how to defeat the virus. We should now tighten our belt and do it. We only can do it. There is no other means. Virus.
Absolutely, sir. Absolutely. Dr. Gupta, your closing comments, last 30 seconds, madam, on the show.
Okay, so I agree with whatever Dr. Mishra has said. Mask wearing, social distancing, we all have to own this responsibility that virus can be defeated, easily defeated, if we actually adopt to all these norms of wearing masks, social distancing, and COVID appropriate behavior. And whenever our chance of getting a vaccination comes, we should go and get vaccinated, because this is an important tool we have. And so go get vaccinated, but do not create panic. I would like to emphasize at the vaccination site. We are seeing the huge crowd coming. There also you have to adhere to your social distancing and mask wearing. And vaccination does not mean that you are totally protected and now I can go mask free. That is a wrong conception. We have to stick to COVID appropriate behavior, even if we are vaccinated, even if we have got an infection. After that also the mask wearing has to be taken care till the virus goes away.
So
We just can't let our guard down at any cost. On
can
that
I
note,
make
so
one
much.
last comment?
Yes, Dr. Mishra.
I missed it. So I just want to assure people that no variant has emerged yet, and no variant will ever emerge which can break through your mask. So
Yes.
that is the solid defense that we have got. Let's use it, and then we can handle the rest of the virus.
So
Thank you.
mask is our biggest weapon, and as I was saying, that we can't let our guard down at any cost. On that note, thank you so much for joining us.
Thank you.
Viewers, that's all we had for you in this edition of India Fights Back. But before that, let me remind you once again to stay safe from the coronavirus pandemic. Remember, as our panelists were saying, to wear a mask and wash your hands and face regularly, and ensure that you maintain physical distancing whenever you're stepping outside. These simple precautions are all it takes to defeat the pandemic. Take care. Goodbye.